And the battery is a little low. So,
Okay.
All right, Dr. Ruffner, if you wouldn't mind just giving me your thoughts on the health reform situation, the bill that's been signed, maybe where the TMA fits into all this.
Yeah, I think really you have to look at it in two ways, and one of them is the TMA itself, and the other is really national health insurance, and they're related, but I think there's some parts of it that the TMA can focus on, other parts that really are going to have to be worked at from a national level. The bottom line, and I think it's really interesting that after 100 years, we actually are getting health reform. I was amazed to hear recently that the first president to advocate for health reform was Teddy Roosevelt in 1912. And his concept was that everybody should have health insurance. Physicians should not be paid fee for service. They ought to be paid a flat salary for taking care of physicians. And that's actually when it started. That was part of his campaign platform for president in 12. He got defeated. And so this struggle goes back for a long, long way. Well, why has something finally happened? I think the reason something's happened is just because of the escalating cost of health care in general. When I graduated from medical school, health care was about 5% of gross national product. It's now 17% and climbing. So the bottom line is I think pretty much everybody agrees something has to be done, including me. So the next question is, what have we got? And in my opinion, what we've got is a poorly conceived disaster. I think the public has been misinformed by being told that this is going to be revenue neutral. I don't believe it is. There are intelligent people that think that it's probably going to cost the country, or let's say it's going to increase the debt by $750 billion over the next 10 years. I mean, that's the reality. That's not what the politicians that passed it think. So I think we've got a big problem. I think the question is whether or not we should try to just get this rescinded, or whether we should try to fix it. And I don't think there are any easy answers to that. But and that's certainly not something that I can make happen. I can get out there and simply point out to the public that they're being sold a bill of goods right now, but that's very different than actually solving the problem. I think the thing that physicians need to recognize at the end of the day is that we do need to do something about controlling escalating healthcare costs. There are thoughtful people who say that there's already enough money in the system to take care of all the uninsured. If we made our system efficient, there'd be enough money left over to do that. So I think that's the challenge. Now for Tennessee and the Tennessee Medical Association, it's a little different issue. To some extent, physicians' negative attitudes about the AMA are spilling over to the TMA. And they are overlooking the valuable things that the TMA can do right here in the state. And I can think of a couple of them very quickly. Certainly at the top of the list is tort reform. I just a couple of days ago got a letter stating, from state volunteers, stating that my malpractice insurance was going down by 23%. The public or the physicians need to know that they have the TMA to thank for that.
That's amazing.
Whether they, and the thing I don't like is that whether they belong to the TMA or not, they're going to get a cut in the cost of their malpractice insurance.
Right.
But those fights are state fights. They're not national fights. And it takes a strong group like the Tennessee Medical Association to work on that kind of thing. Another timely issue that's a state issue is scope of practice, because it's the state that decides just what a nurse practitioner can do, what a chiropractor can do, what a podiatrist can do. So if we want to make sure that the things that physicians do best are done by physicians, it requires our efforts and our voice in Nashville to make these things happen.